Welcome to the latest episode of Healthcare AI. I'm your kind and gentle host, Tod Schlesinger. Today's topic is focused on driving the real-world impact of AI. And to help us understand the potential impact of AI in healthcare, we are extremely excited to welcome today's guest, Dr. Clifford Goldsmith, who serves as Managing Director for the U.S. provider industry at Microsoft. Welcome, Dr. Goldsmith. Thank you for joining us.
Thank you, Todd. Nice to be with you.
So, Dr. Goldsmith, if we could start off by talking about your role at Microsoft and how Microsoft is approaching AI in healthcare.
Sure, be happy to talk about it. So, always excited to talk about this. First of all, my role, I'm the National Director for the provider industry in the US. And so in that role, I design and oversee strategy for our sales team and marketing teams in the US. We're working directly with big health systems, hospitals, and various other provider long-term care facilities. Microsoft AI is central to where Microsoft is in healthcare. In fact, Satya Nadella has said fairly often now that every organization will become a software organization because of AI. And so we really are in a world where AI is changing things. And because of this real emphasis, Satya Nadella, our CEO, has identified AI as a strategy for all countries in the world on a global level. And so one of the things that I oversee is the US strategy for AI for healthcare. And we built that up around 4 pillars for AI. The first is that AI is digitally transforming healthcare. And by that, we mean it's making a fundamental difference, and I can go into lots more detail about that, in the delivery of care, the health of populations, the quality and safety of that care, as well as the lowering of costs and improved operations around care. But digital transformation alone is not enough. Our strategy includes 3 other pillars. The second pillar is forming coalitions, and from my perspective, coalitions in the United States that really can drive AI forward. So these coalitions can be everything from government organizations to associations to professional groups, and ultimately even to data coalitions. And I'm sure we'll talk a lot more today in this podcast about data. The third element of our strategy is that we recognize that in both the IT side and in the business side, people don't have the skills yet to really, at the level that we need them, in order to successfully drive rigorous and scientifically AI models. And so part of our strategy is also to form coalitions with organizations that do training and ourselves training people, both training IT and training clinicians and hospital professionals in the use of AI. But ultimately, the fourth pillar is, to me, the most important, and to the company, and that is that we make that we have significant societal impact on the health of people. And so that's very much our strategy. One other thing I should mention that's really key to our strategy is that we recognize that AI can be used in unethical and biased ways. And so we have a very significant focus on making sure that we deliver the ethics around AI to the community and deliver an ethical and unbiased strategy for AI.
Well, as many of the industries, I mean, we've been talking about AI for a long time. Why is now different? Why do we see this momentum in the adoption of AI?
This is a cliche term, comes from a good movie, The Perfect Storm, and it is cliched, unfortunately, but it is also true in this situation. So what I think is happening on the technology side is we have reached a point with a few elements of technology that make AI possible. And the first is computers are now fast enough to do what we call computer vision. And I put vision in quotes because it's everything from looking at real images and being able to process those in real time to having a vision into voice, gait, uh, muscle movements, posture, things that we've now been able to do, a lot of which has been because of the gaming industry,
Sure.
being able to identify positions of joints and bodies and movement, including even things like heart rate. That our Xbox can detect through, with the Kinect. So that's part of it. But the second piece of the technology piece is the scale of technology today, and that's the cloud. I mean, it's a hyperscale cloud, and it means that we can gather more and more data, use it in bursts if need be, where we need huge amounts of processing for a moment in time to do things, and then being able to release that and doing that in a cost-effective and scalable way. And so the cloud brings attention to AI. Cognitive services have started to bring attention to AI. So things like natural language processing, where so much of our communication has been non-structured communication, just like we're doing on this call today, where we're talking, and starting to bring recognition to those conversations, whether they're written or spoken or other things. Then finally, the data has become we have so much data that's been gathered over the last 10 to 15 years, public and private data. And so the big data element of this is huge. So that's the technology. But the perfect storm is that, to me, is that healthcare is at an inflection point. The nature of disease has changed. The way that we've approached medicine for the last 100 years has been because of a focus on primarily infectious diseases. And those diseases have by and large been solved. I know we still have, pandemic diseases occasionally, or epidemic diseases. I know that we still have new diseases that need attention, like AIDS still needs attention. But we have a strategy for that, and it's not a hospital-based strategy anymore. It's a strategy that uses antibiotics and antivirals and vaccines, and we can really manage that. But what we haven't been able to get our hands around and our head around is a different kind of disease, a chronic disease, a disease caused like diabetes, by obesity, a disease like cancer caused by elements in society. And so we really are at a point where the disease patterns of the world, not just the US. I know a lot of us think about focusing on the US and primarily the cost of care, which is significant in the US, but it's not just that. It's the patterns of disease have changed. So my answer to you, again, is there's a perfect storm between the change in patterns of disease and in healthcare, combined with the power and potential of processing that computing and technology can bring.
How does Microsoft work with some of the major innovators in the AI space in healthcare right now?
So, what we've looked at is a maturity model, and I don't even think that much that there aren't just one group of innovators. Everybody will innovate. It just depends at what level they will innovate. So what we've developed at Microsoft, and we're in the process of rolling out, is what we look at as a maturity model. So for some organizations, particularly the average small to medium-sized hospital, the focus is going to be, which they do today, they do business intelligence, they do analytics.
Sure.
How do you move that BI into AI? So it becomes operational things that you can do. So, for example, you might have been looking at length of stay over years now. You might have been looking at, in a certain way, looking at your population, based on your electronic health records for the last 15 years of admissions to the hospital. That's not enough anymore. That's the BI. That's the old BI. If you know that you expect a higher incidence of patients in let's say infectious disease in July for some reason, whatever it is, that's known, and that's the analytics that we've always done. How do you bring AI to that? So that's the first level. And an example there would be, could you now combine all sorts of factors like weather data, aging population data, publicly available data from the National Institute of Health, and at the same time, social determinants of health, bringing all of these things together, still looking at the same thing that you looked at with BI, but now looking at length of stay in a different way, or looking at forecasting patient load or staffing requirements in a different way. That's the entry level in my mind. So and that's available to everybody today. I think that's probably the low-hanging fruit. It's where everybody is looking, and we see it. It's why the government, Medicare, and CMS puts out a request for AI for a computational model that helps you predict admissions. That's the first level. But let's go up from there. The next level is, what can you do in your systems today with AI that you're not doing? And examples there are things like diagnostics. Go beyond that. Are there new things that we can do? So the third level of maturity is, are there new things that we could do? And these usually are the innovators. So I would say I said at the start that the operational kinds of AI are available to all hospitals. And I think we're seeing a lot of that in the mid-sized hospitals today. The second level of improving diagnosis is probably in the larger hospitals, very big hospital systems, and starting to sort of be part of the academic medical center, particularly where the diagnostics is not fully worked out, like in radiology and lung function and lung images, chest images.
So with all these, please, no, go ahead.
I was going to say the next level up from that is what we're seeing is new diagnostics, and this is an exciting area. But this is happening. The innovators that we work with there are the academic medical centers, usually where they have a research and a clinical arm to them. So new ways of diagnosing disease, using things like social determinants to impact your treatment, your diagnosis and your treatment of disease. So just in summary, it's the innovators that we work with are based on the maturity model, and we work with everyone, but the types of innovation is operational all the way through new diagnostics, through enhanced diagnostics, into this new world of diagnostics and using social determinants to impact health.
So how is Microsoft really helping healthcare organizations really prepare and drive adoption of AI?
So, this comes back to where I started at when you asked me the pillars. That's where we focus in. So so what I've probably gone through with you right now in this maturity model are the elements of the digital transformation that you're talking about. That's what's transforming.
Yep.
But as I said at the beginning, one of the biggest problems, let's start with skills, is that people don't yet have the skills necessarily to do this. So they need help. And it's not just us that recognizes this. All the big technology companies have recognized this. And so we are supporting we are supporting both the informatics department, the IT departments, and the clinicians in getting those skills. But let's be more specific than that. There are differences when we get down to the way different technology companies are approaching this. One of the more simple ways to do this is just to simply provide bodies that can help you. So provide staffing that can help you with that. That is an approach of one of our competitors. The problem with that approach is while it works in the short term, in the long term it has two complications. One is if you're simply getting the sort of gift, if you want, in quotes, gift of people to work on a strategy, you have no idea when that's going to be pulled away. And we really aren't teaching people to fish. Yeah. I mean, it's the old saying. I mean, you want your own resources to know how to do this on a massive scale so that you don't feel inadequate or untrained 5 years from now or 2 years from now when the funding is pulled from that. The second problem with that is that no one does anything for nothing. So there's got to be some quid pro quo to people who provide support. So we don't look at it that way at all. We look at it as teaching people to do what they need to do and owning their own IP. That's key to us. And so we go into this with a combined strategy of resources, people resources, but also technology resources, models, existing models, blueprints, and we do large-scale training. So for AI, we have an AI business school where executives can come to that. We can provide that training for them, and we're doing this in many cities. We have an AI ambassador program, and we're starting to work with the key professional associations in order to deliver that kind of training to their members. So think of the American College of Cardiology. We're talking to them right now in the process of setting up some form of training that would allow continuing medical education to also have an AI component to it. So that's the approach we're taking. And it's the kind of approach where organizations can choose how much or how little they want from us, or they can choose the formula for what they're looking for. And we think that's likely to be the successful sort of strategy in the long term.
So, in the healthcare industry, adoption of new technology is a tricky thing. I mean, how do we address the lack of trust with AI in healthcare?
So this is a great question that you're asking. The answer for me, and I've said this publicly in meetings several times, is we have to acknowledge the areas of distrust, and there are many of those, and we have to talk. I mean, this has to become a public discussion. So let's talk about some of the areas of distrust, and these are for the public discourse, and we've got to be willing to have these conversations. So one of the ones of mine that comes up fairly often is, particularly from specialists and diagnostic specialists like pathologists, cardiologists, radiologists, is AI going to replace me? Is this going to do away with my job? And the answer is clearly no, but it's not. But it's got to be discussed, because what it's going to mean is that you're going to become a different kind of doctor. You're going to become a diagnostician versus just a radiologist. The computer will be able to do over time more and more of the simple diagnostics of picking out a mass or a level of fluid, or an infection, a pneumonia in a lung. The computer will be able to read slides and be able to pick out particular cancers from an histology slide. But what the computer can't do is assimilate all of the data from all of these different areas together in a meaningful way and providing treatment for that. So I think that discussion has to be about, how do you bring together so much new data, so you're no longer just a pathologist. The pathologist will have access to the radiology data. The pathologist will have access to the electronic health record data. And in that process, you now have a new form and that's what we have to talk about, is that new form of a diagnostician. Also, we have to be willing to talk about how physicians become more engaged with their patients because of, so that's the second fear. I'll say, so the first fear is going to put me out of a job. The second fear is probably more the patient's fear than anything else. Is this going to mean that I'm going to be treated by a robot? I'm going to be someone else, I'm no longer going to have that human connection. The exact opposite should be true.
Right.
It should be that we should talk about the fact that you'll be able to spend more time with your patients. You'll be able to discuss the psychological and behavioral elements of a particular illness and treatment. You'll be able to discuss the treatment process. Maybe even AI will give enough information to the patient that they'll understand the diagnostic process and be able to discuss that better. And so that's the second element. The third element is what I mentioned at the beginning, is the unethical and biased use of data. If you train data on a certain population, it becomes very easy to use that model on a different population without retraining that model and making certain inferences. And this, it could be racial, it could be ethnical, it could be ethnic, it could be against, it could be something that's used in a sexual context against men versus women, or women against men. So it's really, really important that we have those discussions of how the models are developed and the bias within those models if you were to use them without retraining. So that's another element of discussion. And then, there are other elements of this. I think on one level, the early sort of activation of AI to mimic a human being was good, because it got things going. So you had things like Watson playing Jeopardy, or Watson or Big Blue playing chess,
right.
And it was really mimicking that behavior. The problem with that is that it, when applied in other settings that was not that specific person behavior, people and behavior, it didn't work as well. And we have to acknowledge that those were the early days of AI, and that we're now in a new world. It's also very, very important that when you create models using data, that we need the interoperability of that data, and that's important. So improved interoperability for AI, and it worries people that we don't have enough data. But it's also how that data has been identified. I think it's really important that we choose our best experts, our best subject matter experts, to tag and identify data. In order to, it's not just a matter of crowdsourcing. It's a matter of having good data. Everybody says, bad data in is bad results out.
So you mentioned data and several times, and data and security are such important topics in healthcare. And how is Microsoft ensuring that patient data is being kept securely, and privacy is being addressed within these AI systems that we're seeing more and more of?
So that is key to us. I mean, for the last decade or more, we've recognized that. I mean, this is not just a problem of AI; it's a problem that gets enhanced because of AI. But we have been at the forefront of security, and what it means is, first of all, absolutely adhering and making at the center of what we do in our company around the industry standards for security. So we were the first out of the gate about 10 years ago, jumped into HIPAA. We watched it, we monitored it. What we did is, it wasn't just our clinicians doing this or our sales teams doing it or our marketing people. We actually had our legal people do that. And so it wasn't, they took it on seriously. They understood the laws, they understood the requirements, and they built that into our agreements. So we were way ahead of everybody else in signing BAAs, the business associates agreements, which are required as part of HIPAA to say that we will take responsibility for our part in the chain of security and privacy. And we'll guarantee that. The interesting thing is, because of that being out there so early, it's evolved a lot and we've learned a lot. But it also made it possible that we could we could adopt the next standard even more quickly and more successfully. And so when GDPR came out, we were able to immediately to ensure that our systems were compliant, and we had the process down, the legal team down. So we've had a lot of experience in doing this. I do think important is that we became a member of the High Trust Organization about 5 or 6 years ago. And what this meant was that we were no longer just looking at a single certification for privacy and security, but we started to look at 60 or 70, I think there were at the time, different requirements, all of which had to be met to get high trust certification. And it gave a comfort or peace of mind to our customers that they knew we were high trust certified. But let me go beyond all of this, because that's the healthcare side, and I start there. But there's the wider world of security and privacy. We run one of the biggest networks in the world, if not the biggest, and we have immediate access. And think about AI. Here we are talking about AI. We have immediate access to what people are doing from a privacy and security point of view on that network. So we know we have a cybersecurity center and that runs AI all the time, monitoring the ways that viruses, that spam, that that malicious attacks are being orchestrated around the world. And so by using that, we're able to really act very quickly and secure and patch the ways that people are using, maliciously using technology to disrupt and security and privacy. So on a big level, it's a very big part of what we do. You need a very good de-identification system, by the way, as well. In order to build AI models, that data is going to always be slightly exposed. And so de-identification has to be a very strong element. So we've actually had our engineering team in healthcare work on a de-identification tool and service for data while you're building models. And this means de-identifying not just digital data that's text data, like your electronic health record, but removing any identification from images, like radiology images.
So staying on the data theme, I mean, how does, in healthcare, they're notorious for having inconsistent and sometimes incomplete data. How does that impact some of these AI technologies?
It's a big problem, this. I think the idea of just getting lots of data was what happened over the last 5 or 6 years. And so we all know that there's a very big variation in quality of data in every walk of life, not just healthcare, on the internet. Some data is good and some data is bad. And we learn as human beings to discriminate that data. And so people who use the internet effectively know when to trust a site and when not to trust a site, know when to trust data and not trust it. We have to take those learnings and build them into how we make the data available in healthcare, and how we tag that data, how we identify things in that data. And again, I think it goes back to the partnerships with the best organizations in the world, and not just anyone who has data. So I think we have to prioritize building data models off the leaders, whether that's Mayo Clinic in cardiology, or, Dana-Farber in pathology, whatever that is, or Johns Hopkins, which is a big partner of ours, building precision medicine models right now. I think it's really important that we use very, very well, that kind of data that's been well identified, and that we build as well. We further identify data if need be, whether that's private or public data, if that data is deficient in any way.
So, from your perspective, what are the lessons from other industries that healthcare can look to as we continue to evolve and build our understanding and adoption of AI and the impact we want to have to patient outcomes?
I think there's some lessons we can learn from other industries, but typically those lessons in many of those industries, the way that data is used is not as complex. So if you take manufacturing, for example, while I think we've been able to learn about how to use computer vision effectively from manufacturing, it's a very good area. One of the things that you might have seen, some of the models where a computer scanning a video of a manufacturing environment can pick out if something is unsafe, if a procedure is happening in an unsafe way. That you can't really do that completely in healthcare, but we've obviously honed the computer vision. I think what we've got to learn is we've got to take those processes that have been learned in manufacturing and apply the clinical process on top of it. So good example would be, Lean and Six Sigma are great mechanisms for improving processes as we introduce new AI models into manufacturing.
Sure.
But what we've got to add in the clinical setting is something that describes the patient journey in its fullest form as well, on top of that Lean and Six Sigma, so that the processes are being entered into a known and process that happens in a way that is happening in that particular hospital. And one of the other things we have to see in hospitals, which is different, is manufacturing processes can often be replicated from factory to factory. Very often in hospitals, they're not replicated. You've got to adjust it slightly depending on what your level of specialist is, your staffing, your community, and others. So I think it's an awareness of the fact that we can't just transplant what comes out of other industries into our industry.
So on that theme, if you could deliver one piece of advice to providers that are on this AI journey right now, what would it be?
One piece of advice. Okay.
Pick your favorite.
My favorite piece of advice is that healthcare has always been rigorous and scientific, right back to the earliest Greek and Roman days. And what we have to do with AI is use that same scientific rigor to develop our models. We can't just go out like the Wild West, as is happening right now, making models with all of the things that we've talked about here that are concerns. We have to provide a rigorous, scientifically adjudicated process that moves new models from research into clinical in a systematic way, in a tested and rigorous way. That to me is the message that it is the key message, because I think right now there's this feeling that all you need is a computer and a bit of data and a
magic
tool,
wand,
and you can make something happen.
Well, Dr. Goldsmith, this has been absolutely fantastic. I can't thank you enough for spending the time with us today and sharing your insights about artificial intelligence in healthcare.
Well, thank you so much, Tod, and thanks to Jvion for this as well. So I really appreciate it.
Thank you. We appreciate your time. Thanks so much to our guest, Dr. Goldsmith, and thank you for listening to Healthcare AI with me, Tod Schlesinger. If you like our show and want to know more, check out our website at jvion.com and look for us in the coming months on iTunes or wherever you get your podcasts. And join us next month when we talk about AI's role in cancer care.